Lesson 4 Number 5 The three-dimensional technique. The microendoscopic technique Akiyama method can better recognize the 3D view more than the naked eye. The technique name is the three-dimensional technique. If we can see the XYZ axis point from the same angle with the surgical microscope in direct view, we can better recognize the 3D view more than the naked eye. This technique's name is the three-dimensional technique. It's based on the microscopic technique Akiyama method. In fact, we have to think about the quality of the direct view. The microscopic technique Akiyama method takes into consideration, therefore, it is superior in its ability to recognize the 3D view. Case: both apparatural incisors will be treated for dental implants. Treated by other orthodontist, right side. Treated by other orthodontists. So right side width is 6.72, left side 5.28. The width of the right and left apparatural incisors are both quite different when consideration placement of dental implants. The left upper incisors width is too narrow for placement of the dental implant. The right upper canine to dental implant space is 1.3 mm at distal side. The right upper incisor to dental implant space is 2.1 mm at medial side. This is where place the dental implant. The left upper canine to dental implant space is 1.3 mm at distal side. The left upper incisor to dental implant space is only 0.7 mm. This is where I placed the dental implant. After placement of the dental implant, I perform orthodontic treatment. The width of both dental implants will almost be 1.3 mm. The right upper lateral incisor space is extremely narrow and there is no bone for the ideal implant position. The implant angle must be changed to the palate side. The three-dimensional technique. This is my technique, based on the microscopic technique. So, I press the dental implant, right apparatural incisor area. The left apparatural incisor space is extremely narrow and there is no bone for the ideal implant position. The implant angle must be changed to the palate side. The three-dimensional technique. This is my technique. So, I place the left upper lateral incisor area to place the implant. After placement of the dental implant, I performed orthodontic treatment. Press second orthodontic treatment. So, press second orthodontic treatment. So this is after treatment, post second orthodontic treatment. So good, very good result. This is the right upper lateral incisor area. This is the left upper treatment result. So biological wheels check of the left and right dental implants. So this is the right upper lateral incisor area. We will check. So very beautiful and healthy condition. This is the right upper lateral incisor. Same, good condition. Beautiful dish. So, this is a post-surgery 2 years, 5 months. Very good, beautiful and very healthy. This is a right upper post-surgery 2 years, 5 months. Result, very good. Beautiful papilla. The 3D-dimensional technique. This is my technique based on the microendoscopic technique. The 3D-dimensional technique is the next stage in the surgical microscopes technique. The Super 3D view. How about the loops? Number 6. The 10 reasons why I quit using the loops. Number 1. At the same magnified level, the surgical microscope's field of view is larger than the loops. So microdental research, we will check the Carl Loop's field of view. So this is a company advertised. So Carl Loop's field of view 3.5 magnification is 86 mm. 4.5 magnification level loops is 68 mm, but a little bit different my findings. After checking Carl Loop's field of view, my results show that the company's advertised field of view is incorrect. My research shows the real field of view much smaller than that which the company advertised. The real field of view isn't round. In fact, the real field of view is oval. This is my research. Akiyama's findings of Carl Loop's field of view. This is the result. My research shows the real field of view. The real field of view is much smaller than that which the company advertised. Microdental research comparing the real field of view and dental field with the loops and the surgical microscope. So this is the research. So maxilla, the width of Japanese teeth, male and female. So this is a mandible, the width of Japanese teeth, male and female. So this is a loop's field of view 3.5. This is a surgical microscope. The result is that the surgical microscope's raw magnification field of view is wider than the loops. Therefore, Carl-Zeiss picomolar is better for dental treatment when comparing it to the loops. If what the company had advertised was correct, then both field of view would almost be the same. So 3.4 diameters, 65 millimeters field of view. So this is the surgical microscope's field of view. The microscope's field of view is brighter and clearer than the loops. The surgical microscope's right source is quite stronger than the loops. So number 3, at the same magnification level, the surgical microscopes can see small details more clearly than the loops. Number 4, at the same magnification level, the surgical microscope can produce much more natural colors than the loops. Number 5, the microendoscopic technique's ratio of the direct view into the mouth is much higher than the loops. Number 6, the microendoscopic technique's dentist posture is better than the loops. If we compare the loops and the surgical microscope with the same magnification, the view quality is quite different. The surgical microscope's view is more beautiful than that of the loops. I never use the loops for dental treatment in my daily practice. The loops also makes an obstacle like the 12 o'clock conventional technique. The dentist's posture is bad when using the loops. The microendoscopic technique, Akiyama method's posture is very good. The microendoscopic technique, Akiyama method, is a new innovative technique and is very effective for every dental treatment. However, in order to use the microendoscopic technique, we must use the Carl-Zeiss or PMI Pico with more surgical microscope. So, number 7. The loops continuously vibrate during treatment. This is a natural movement when using the loops in dental treatment. Maintenance and periodontal treatment is very difficult when using the conventional technique and loops. Number 8. Dental treatment needs various magnification levels for each situation. Number 9. The quality of treatments when using the surgical microscope is far superior than that of the loops. The loops only has one magnification level. It is very difficult and highly inaccurate to treat with only one magnification level. Since dental treatment sometimes requires high magnification and at other times low magnification, I think it is necessary to have access to various magnification levels for each dental treatment as every situation is different. For example, if we need to make preparation for a bridge, it is vital that we take care about each tooth's relationship to each other. Also, it is important that when doing so, we must perform highly accurate preparation for dental bridge. In periodontal treatment, if I perform regeneration therapy, I need a 21.3 magnification level. This is so that I can see the root's surface through the pocket, which isn't achievable with any highly accurate level when using the loops. Therefore, in my opinion, it is extremely difficult to completely clean up the root surface with the use of the loops. So, the magnification of the surgical microscope for dental treatment. So every dental treatment needs variety of the magnification level. Some opinion says the beginning of the golf was hit a stone into a rabbit hole. After the invention of golf, there has been much innovation and completely changed modern golf as we know it today. Modern golf needs a variety of gears. Loops treatment is similar to playing 18 holes of golf with only using a 7-iron. Loops treatment is similar to cooking a delicious dinner with only using salt. So number 10. We can easily move and look away from the surgical microscope. When treating with the surgical microscope, if we need to pick up an instrument from a tray, we can easily move and look away from the microscope and quickly pick up the needed instruments, and we can then immediately return to viewing the treatment area through the microscope.